Hello, my name is Dr. Peter Slater. I'm an adult psychotherapist and a child and adolescent psychotherapist here at Harley Therapy. I've been in practice as an adult psychodynamic psychotherapist for 18 years and have practiced as a child and adolescent psychotherapist since 2008 when I qualified from the Tavistock Clinic in London. I've worked as a child psychotherapist for many years in NHS, CAMS settings and in private practice. I recently designed and developed a child and adolescent psychotherapy training program in New Zealand, which is now a well-established community program there. Today, I would like to give a brief insight into child and adolescent psychoanalytic psychotherapy, how it works, and the kinds of presentations it is effective in dealing with. Please feel free to contact us here at Harley Therapy if at the end of this presentation you have any questions or would like to find out more details about this form of psychotherapy and whether it would be suitable for your child. Children and young people with moderate or severe problems may respond to people and situations in ways that they do not understand and often can't control. Emotions can be extremely powerful, often overwhelming, and therefore difficult to regulate or control. Such emotions are usually expressed through the child's behaviour, which over time can have an impact on emotional, cognitive, or social development. The child and adolescent psychotherapist's focus is on the complex emotional lives of the child or young person, but support can also be given to the parents or family as a whole. This is a psychoanalytic approach which seeks to look beneath the surface of problematic emotions, behaviours, or relationships, and to help children and adolescents and their families to better understand themselves and their current difficulties. Child and adolescent psychotherapists are trained to carefully observe a child or young person and respond to what they might be communicating through their behaviour and through their play. The rigorous training enables a child psychotherapist to develop and sustain relationships with children and young people whose difficulties may be long-standing and severe, and whose levels of disturbance may make it hard for them to benefit from other forms of support offered to them. A child and adolescent psychotherapist can help a child or adolescent to understand himself or herself through the therapeutic relationship. The problems identified within this relationship shed light on those in other relationships in the child's life outside of the therapy, whether they were in the past or occurring now in the present. During a therapeutic session, younger children may be encouraged to play, while older children may wish to draw or paint, and teenagers who are more able to talk about their feelings. Through the relationship with the therapist in a consistent setting, the child or adolescent may begin to know and to feel able to express their most troubling thoughts and feelings. With younger children, much information and insight can be gained through their play. How does a child play? Can a child develop stories in their play? What are the themes that emerge from this play? All of this is vital information in gathering a picture of what the child is really struggling with inside. Being able to offer this in-depth form of therapy enables me to work with some of the child's most difficult emotional experiences that can often lead to development in one area or another getting stuck. Helping the child make sense of their experience and develop their own individuality and potential is a key outcome of this form of psychotherapy with children and young people. Confused, frightened, hurt, angry or painful feelings can gradually be put into words or symbolised through play. What we find is that when we talk or play such feelings through, there is much less need to turn to actions or behaviour. As a result, the child can begin to express their emotions in less disturbed or damaging ways, and development can be freed up to run its more natural course. Having shared such feelings with a child psychotherapist, they are likely to feel less anxious, freed up to take in more information in, and learn more effectively and be better equipped to sustain friendships. Significantly, it can also improve the quality of life within the family or in relationships with carers and professionals such as school. At times, it is useful, with the parent's permission, to observe a younger child in the school environment and to consult with the teachers in order to better help them to understand the emotional life of the child and their behaviour. Child and adolescent psychotherapists may see children and young people individually or with other family members. They also apply their framework of thinking to work with parents, families and carers, and to training and supporting other professionals who work with children and young people, and to encourage a deeper understanding of the child's perspective. In my work, I offer assessments, observations, short and longer term work depending on the nature of the presenting issues. Invariably with younger children, I will offer regular meetings with parents to discuss progress and to help parents better manage a child's more challenging behaviours. I have regular consultations with parents whose infants are finding it difficult to feed, sleep, or who are unusually distressed without any physical conditions. As a child psychotherapist, I'm also trained in mentalisation-based therapy with families, which is a very effective form of family intervention. It is usual practice that when a young child is referred by parents for an initial consultation or an assessment, that I meet with the parents first of all, without the child being present. This allows me to get as much background information and to obtain a full history of the development of the child from birth onwards. This information might be sensitive and is often easier for the parents to talk more freely when the child is not present. The aim of this first session is to gain as complete a picture of the child as I can, which will aid in terms of formulation and whether ongoing psychotherapy is indicated. Much research into the effectiveness or efficacy of child and adolescent psychoanalytic psychotherapy has been undertaken. In 2004, as part of a systematic review of research into the effectiveness of psychoanalytic psychotherapy, it was found to be effective in treating children and young people with depression, anxiety, aggression, and other behavioural issues. It works with personality disorders, learning difficulties, eating disorders, self-harming behaviours, developmental difficulties, children struggling socially, and children on the autistic spectrum. Perhaps the most striking results of this form of therapy were highlighted by Jonathan Shedler, the Associate Professor of Psychiatry at the University of Colorado. Shedler carefully analysed the results of randomly controlled trials into the effectiveness of psychodynamic psychotherapy treatments. He and his colleagues concluded that the positive changes seen during therapy continued to develop long after the therapy had ended. This has been termed the sleeper effect and was subsequently substantiated by a research project into moderate to severe forms of depression by David Taylor at the Tavistock Clinic in London. Shedler's findings also suggested that psychoanalytic psychotherapy provides patients with the tools to continue to function better in the world, to feel better about themselves, and to reduce psychiatric symptoms, to better face life's challenges with greater flexibility and freedom well beyond the end of their therapy.